So that was a wonderful talk, Arbaz. Thank you very much. I've learned so many points from you. Thanks that I'm happy that I'm learning from my students. I've listened to Arbaz's talks. I'm a fan of his lectures, his professorial lectures. Really, I'm sure he's going to make a big, big teacher one day. God bless you, my dear Arbaz. Anyway, I don't know where to say. I was wanting to give only 5 minutes to him, but I was, dumbstruck. The way he was going on and on and on was awesome. Anyway, it was too much for me because I forgot my embryology. But I don't know how much for you have understood all this today. Anyway, that was needed for you because we are talking about the esophagus today. Right. Let's get going. So we spoke of congenital diseases and acquired diseases. In the congenital disease, we have commonest atresia, and then different shapes of congenital abnormality that esophagus will have. Atresia and H type of esophagus. H type of esophagus, where you have tracheoesophageal fistula and you have a hiatus. Even hiatus can be a congenital defect. There's a defect in the diaphragm, the hernia, the stomach and the esophagus and stomach tend to go up into the mediastinum, causing the hiatus hernia. So, yeah. Then we have, this is a small bit of congenital diseases. We have, even in the hiatus, we have many types of hiatus that those details are not necessary. In the structural diseases, these are all congenital diseases. Like you can have a stricture, you can have a H type of esophagus, you can have a hernia, you can have unformed, you can have a gap between two ends, and so many types of congenital defects are there in the esophagus. Then coming to the structural defects, you have again hiatus is very common. Hiatus hernia can be, it's so common, it's very common. Many times when we are doing endoscopy or when you're doing ultrasound, they report as a mild hiatus hernia. It's very common. It can be totally asymptomatic also. Many hiatus hiati are asymptomatic, and it's very common. Then again, as I told you, it can be of many types. 90 to 95% are sliding type. Sliding is just the can you show this? The esophagus. The esophagus from here, it will herniate into the thoracic cavity. Herniate into the thoracic cavity. That is a sliding. Just it will slide up into the mediastinum. That is the commonest type of hiatus. The remaining 5% are type 2, type 3, type 4. They are not really necessary for this. So the main cause of this weakness in the phrenoesophageal ligament. We have a phrenoesophageal ligament. This keeps the esophagus in position. The ligament connects from the diaphragm to the esophagus. If that is a little bit weak, you get this hiatus, which is a very common. And you have another type, paraesophageal. Paraesophageal means, can you show here? Yes. Paraesophageal means the esophagus remains same, but when the stomach part gets, in part of the stomach, the fundus gets into the mediastinum. That is the paraesophageal. One is sliding, the whole thing goes inside. Second is paraesophageal hiatus hernia. So these are the common varieties. How does the patient come to us? What are the symptoms and signs of hiatus hernia? What are the symptoms, signs? As I told you many times, they are asymptomatic. If symptoms are there, they can come with dysphagia, reflux, regurgitation, all those things. But many times they are asymptomatic. Many times. Okay, what are the causes of acquired hiatus? Acquired hiatus hernia. It's commonly seen in obese people or people who have a chronic cough with raised intra-abdominal pressure, especially elderly people who gastroesophageal sphincter is lax. So these are the special group of people. Pregnancy also, for that matter, when there is raised intra-abdominal pressure, causes mild sliding up the esophagus into the thorax, causing the hiatus hernia. Even pregnancy sometimes can cause a transient hiatus. And it could be hereditary also, the congenital hereditary. So that is all about atresia, hiatus hernia. Then the hiatus hernia people will come with retrosternal discomfort, sometimes dysphagia, sometimes GERD like picture. So hiatus hernia can cause GERD, but GERD itself also can cause sometimes hiatus hernia. And different other deformities like rings, structural deformities as rings. So the esophagus gets constricted in between and patient will have difficulty in swallowing for solids or liquids. Then we have webs, as Arbaz was telling us, webs, diverticulae. These are the various congenital abnormalities that we see in esophagus. So we also have B-ring and membranous rings, and very different names are given, the web constrictions, etc. Then coming to motility disorders, very importantly, we have achalasia. Achalasia means, achalasia usually, we call it as achalasia cardia. Cardia because it occurs usually, the usual site of achalasia is the cardiac end of the esophagus. Cardiac, that's the lower end of the esophagus. Lower end of the esophagus fails to relax. Lower end of the esophagus fails to relax. When you're eating, the proximal part of the esophagus gets bulged out, distended. With sometimes the esophagus may look like a stomach. So the lower end of the lower end of the esophagus fails to relax. It will be something like this. The lower end of the esophagus fails to relax. So here the relaxation is impaired. So the proximal portion of the esophagus gets bulged out, something like that. So there will be stasis of food contents here, having retrosternal discomfort, difficulty in swallowing. These kind of patients will have to drink more water, 3, 4, 5, 6 glasses of water after each gulp. So they require more water to push the food down little into the stomach. So these are the symptoms that the patients can come to you with achalasia. So second is esophageal spasm. Say achalasia, there is no specific treatment. You know, if it is mild, it's not causing many symptoms, we can just ignore it. There is no specific medical treatment, though we give some treatment like calcium channel blockers. Calcium channel blockers, which are the anti-hypertensives, actually also help the reducing the spasm of the lower esophageal end. And we have, as I told you, spasms. Esophageal spasms are sometimes common. Many people come with heartburn, chest pain. Sometimes we get confused with acute MI and other complications. So the esophageal spasm, especially interscapular pain while eating or after eating. So this is not very uncommon. Esophageal spasms also we do get sometimes. And of course, GERD is very common disease. GERD also one of the motility disorders that we can talk about. And GERD we'll talk in detail when we come to it next. And then another important disease in esophagus is eosinophilic esophagitis. Eosinophilic esophagitis. Eosinophil is a very beautiful WBC. Very beautiful WBC. It stains hematoxylin and eosin. Eosinophils are spread all over the body, except the esophagus. Your esophagus does not contain the eosinophils. But when it is invaded, when there is some inflammation, some cause, the eosinophils evade the esophagus and calling eosinophilic esophagitis. That's the rate. When you do, these patients will come with the GERD symptoms only. Symptoms are GERD because GERD is not a disease. GERD is a presentation, is a manifestation of so many underlying diseases. So eosinophilic esophagitis also can present like your GERD.